Welcome to the Care Right podcast, your go-to resource for all things elder care. Guiding us through this journey is Annalee Kruger, the founder of Care Right Incorporated, and she has been steadfastly supporting families across the United States. Each episode brings you expert insights, innovative strategies, and practical advice, ensuring that you're well equipped to provide the best possible care for your loved ones. Expect to gain valuable knowledge, learn from real-life stories, and get inspired to take action in your own caregiving journey. So buckle up as we dive into an in-depth discussion of elder care planning and together embrace the journey of caring for aging loved ones on the Care Right podcast.
Hi everyone, I'm Annalee Kruger, the owner of Care Right Incorporated. We work with families all across the globe in developing customized aging plans. Usually who calls us is the burned out son or daughter who is taking care of aging parents or aging loved ones, and they are finding that caregiving has derailed or impacted their careers, their finances, their physical health, their emotional health, and their relationships with their siblings and with a care recipient. So we are the only, so far, only virtual consultancy company who facilitates family meetings, and we're all virtual. Families don't live down the street from each other like they used to 35 years ago when I first started working with families. And so we facilitate family meetings and help you sort out care options based on what you can afford and what the care needs are of the care recipient. Most of our families, of course, want to age in place at home. And so we also, though, do long-term planning as far as if or when aging in place at home is no longer feasible or safe, what does that next step look like for care? And we serve our families all the way from the beginning of services. Most families stay on services for patient advocacy, ongoing family meetings, facilitation, and then just the bumpiness of the aging process. So most families stay on services through end of life because we coach them along the way through each of those different transitions that life throws at us. So we always have really cool people on our podcast as a guest, and today is no different. Today we have Kevin. Kevin has a home care company here in Naples, Florida. So he's actually in my own backyard. We don't usually have people in Florida on the podcast sometimes because we're nationwide. So it's kind of nice to have a Floridian on the podcast today. So Kevin, why don't you introduce yourself, your company, and we're going to talk today about just kind of the landscape of healthcare and what that looks like and how to prevent caregiver burnout. So take it away. Tell us about you.
All right. Thank you so much for having me today, Annalee. Yeah, my background for the past 20 years has been in the senior living field, and fell in love with serving and caring for elders once I get into that field. We started our home care agency 2 years ago, and the purpose behind our agency, the why we wake up every morning, is to help people reach their full potential so they can live their best life. What that means is we provide not only a safe environment, help our clients gain their independence or keep or gain their independence, but we ask them what their growth goals are. We built a very unique model. The people that we select on our team and also the resources we provide are built around helping people, our families, reach their goals. We have a huge focus on the entire family. Our care partner is a person we care directly for, but we also care for the entire family. Myself, I'm a family caregiver myself. My wife, Melody, has dementia. She got diagnosed when we first started the agency. So I know from a personal standpoint, I have 100% empathy for the families we serve. And we've learned the importance of looking at the entire family when we come in and do our assessments and care plans to make sure everyone's supported and cared for. We serve both Lee and Collier County. We're in Southwest Florida, and very, very happy to be here with you today.
I'm happy to have you here too, and I'm really happy that we've met. We've had some really engaging conversations the couple times that we've gotten together, the couple times that we've had our meetings, and it's really refreshing to find a company who still cares about the outcome of their clients or their patients, and who really looks at the big picture instead of just, well, this is what we do. You do a good job of connecting your clients to other resources that can help them be successful. And we all just work as a team, a collaborative team together, which is what my business model is as well. And that's what I'm trying to get the rest of healthcare to do. So anyway, let's talk about the landscape of healthcare. Like, what do you see out there? What's going on in your world?
Well, the biggest thing you're hearing about, and it's been over the past few years, is the labor crunch and stretch on people. And I hear a lot of peers in other industries, but within our industry, peers within home care, but other parts of our field, all they talk about is hard to get people, hard to get people, hard to get people. So that's probably the biggest thing you hear. When we started the agency, I really didn't focus on that fear. I focused on a solution to it, which is retaining people. So that's probably one of the biggest things. I think another big area is procrastination, and I know you see it in your agency. We see it. I talk to elder law attorneys. I talk to retirement communities, and people procrastinate whether it's denial or not knowing what the resources are, how to fund the support that they need. People aren't getting the support quick enough, and we see a lot of burnout. People are coming to us in crisis, which I know you and I have discussed is a very common commonality between our organizations. Those are the two biggest, I think, the two biggest things that I'm seeing in our field right now. Yep.
Yeah, I agree. And I feel like, I mean, that's one of the reasons I started Care Right in 2011 is, you know, back then I was working in continuing care retirement communities, and part of my job as social worker and an executive director was to always do the tours of the care community every single day for over 20 years. Families were coming in the same variation of the same problem. Mom had a medical crisis. She's the caregiver to dad with dementia. What do we do? Well, through the course of time, when families started moving away from each other, you got a son in California and a daughter in Ohio, but mom and dad live in, some other state. They're like, what are we supposed to do? And, unfortunately, the kids were always the one doing the tours and picking the facility. There is that t-shirt out there that's, be nice to your kids because they're picking your facility. And that's, unfortunately, that's true because people don't put an aging plan in place. Right. And so, it's sad to me. And I was hoping that by now I would have fixed the problem in the industry. But, in healthcare, physicians will say you have a diagnosis of, frontal temporal lobe dementia, and good luck to you, or Louis, whatever the diagnosis is, and then good luck to you, and we'll see you at your next scan in a year or two, or doctors not identifying caregiver burnout when it's so very apparent. But, and it's not the doctors, it's just the industry has changed. The healthcare model has just been more about volume, get people in, get them out. Well, that's what happens is these families are falling through the cracks. Yeah. And that's why I started my company, is to do that more white glove approach, hand holding, to help them understand caregiver burnout, what that looks like, and what happens if you don't address caregiver burnout. And if you don't put an aging plan in place, you're going to get that much more burned out. Also, families don't understand dementia or the diagnosis that their parent has, so that's where we fit into all of this whole planning and education piece. But we don't provide the care. That's where you come in, and, it's you and I kind of battling the healthcare industry, trying to change it so it's more consumer oriented and patient centered, like what it should be before like insurance got all in there and had to change all that for everybody.
One of the things we're working on, we created some education around being more proactive. We're going out to retirement communities, to 55 and older communities, and talking ahead of time about procrastination, why it happens, how it hurts not only the care partner, the person receiving the care, but the family members. And we also talk about how to prevent it through self-care and then getting resources earlier. And it's amazing how the light goes off. It gets, those discussions are very emotional. Tears are coming. You can see the burnout on people's faces. And it's a huge issue. So education's what we're working on. And one of the next things we want to do is get to those physicians and start showing them how we can help educate, because it only helps their patients in terms of awareness and the support and resources. Yeah.
Right. And the physicians don't have time to handhold. That's where healthcare done right. They should pass the baton. Healthcare done right. They should pass the baton on and say, okay, Care Right helps with understanding the disease and aligning the care. And home care companies, they do the hands-on work to help mom and dad be safe and comfortable at home and make sure that they're taken care of properly. So that's how I'd like healthcare to go, healthcare done right. But we have a long ways to go, or I have a long ways to go. So tell me, we've had some conversation about how you do things differently, like your hiring model is different than other home care companies. You don't hire to just fill the position so you can take on a new client. You have a more thoughtful way and a better screening process to just add to your team instead of just hiring to hire. Tell us a little bit about that.
So we built our selection process and what we call our people process. There's four major components of it around retention. To me, that's the most key focus area. The home care industries had an average of 70% turnover rate over the past 9 or 10 years. Everyone thought it was COVID caused it. No, it was the same straight through COVID. So it's been a chronic challenge. And the first 90 days is where most companies, whenever industry you're in, lose about 75% of their people. So we built the whole process on retention because that is where the continuity of care and support and deep relationships with our care ambassadors and the families come in, is having that same person for extended period of time. So our selection process, we are very, very hard agency to get into. We new team members that come on board say, wow, it was hard to get in here. So when you look at webinars on hiring, they all communicate speed. It's all about being the quickest and the fastest. We do the opposite. We take our time, and we have a very thorough process. We have multiple interviews. At least one of them is live. So you can see the personality, the presentation of the people, and you really communicate well. We have multiple interviews. It's not just one and done. After we have 7 very strict criteria that we look for, and those 7 criteria are based on our purpose. How can we help people reach their full potential so they can grow? It's very different for someone to come in and do exceptional care. We want to do that and provide that growth. So we don't hire people unless they hit those 7 criteria. We turn down people, Annalee, with 15, 20 years of home care experience. And they look at us like, you're not hiring me? I got 20 years experience. So like, well, you don't have this, the heart we're looking for and the criteria. So that's been very effective in our selection process. Then we do obviously all the background checks and the reference checks, but the key is taking our time, get to know the person, let them get to know us, multiple interviews, and having those criteria that we evaluate every candidate against, and having the courage to stick to it no matter what.
Mm-hmm.
We're not going to hire just to fill a spot, just to get a new client. That's not what we do. It's not integrity.
I think, and this is not intended to be a slam on other home care franchise owners or anything like that, because we all start we all have a mission of doing right by our clients and right by the world with our businesses that we start, right? Like that's one common thread that all entrepreneurs have. But what you bring to the table that sometimes other home care companies don't is you already have you have a leadership mentality already. And what I mean by that is, there was a home care company that I did some training for their staff, dementia training for their staff. And so obviously I got to know the home care owner, the franchise owner, and they used to work at like a Verizon store, and they're just like, we don't want to do this anymore. We want to get into the healthcare space, but they didn't have any leadership experience or any other type of experience. They didn't understand dementia. They didn't understand pressure sores. And, so these are people that are coming from a completely different professional experience into, where they're taking care of people who are vulnerable adults. They're dependent on those healthcare workers to be properly trained and properly supervised and stuff. So I think that what's I love about your company is that you and your leadership team bring already some of that corporate leadership skills and the importance of workplace culture and really treating your employees right, and that's not every company has that, unfortunately, and that's why they have so much turnover. They're not thoughtful about their process.
Yeah, our leadership team is comprised of 3 people right now. And if you add up all of our leadership experiences over 75 years,
Yeah.
and in that 75 years, 100% of it's either in acute care hospitals or and the majority of it's in senior living field. And one of the things we've learned over years, decades of experience, is how to attract and retain top talent. And that's been our primary focus from day one since we started the agency. It's if you talk to my administrator, Liz, she'll say it took me 4 months on the interview process. And that was the person. That's the person that's going to help drive our culture. And culture fit is absolutely what we look for because all a culture is the people on the team. So yeah, we have a ton of experience, and we're using that experience. I've had experience at a national level, growing up through the ranks. My other 2 team members worked in, managing departments in memory care centers and hospitals and whatnot. And it's just a great puzzle piece, our leadership team.
Mm-hmm. Yeah. Yeah. I always say the word thoughtful because it wasn't willy-nilly. It was designed that way. And that's why you're having the successes that you are. And just as importantly and more importantly, that's why your families that you're working with are having the successful outcomes because you did put that thought into it. You have a unique hiring process. Tell me, because we would hope by now that the consumers in general understand really what home care is, but many people don't. And they all have the goal of wanting to stay at home, but they don't really know, okay, how can I make that happen? So if you have a couple minutes left, if you want to share just like, what is home care and how do you help people age in place at home?
Yeah, great question. So home care, we help people stay safe and independent in their homes, like I mentioned earlier. And what we do is we address it's called activities of daily living. We do a thorough assessment with the entire family on what our care partners want and what they need. And then we do a customized care plan. So some of the activities of daily living might be medication reminders, might be meal preparation, might be light housekeeping. It could be help with incontinence issues. It could be help getting dressed, bathing. Could be booking and taking our families to doctor's appointments. So those are the basic activities of daily living that we do when we come to assess. So that's the core of what we do. And when we do those assessments, we ask questions like, what did you used to do that you want to get re-engaged in? And that's the goal we focus on to help and build our model around to help people grow and reach their full potential. Yep.
Yep. And the obvious value is too that, A, mom and dad get the care that they need. B, the adult kids can just be the son and the daughter, or the spouse can just be the spouse. You don't have to be the care patrol. You don't have to be the one to toilet mom or dad, or be the one to take them to the shower and those kind of things. So that role change helps. And you know this too because you're a caregiver for your wife, but it's hard to feel like you're a spouse when you just took someone to the bathroom and have to clean them up or shower someone is in your family. And so it helps, your services help families get back to the roles that they're the most comfortable with and that they want to have.
And the other thing too is, and I realized this through my personal experience. I'm my first customer, by the way.
Mhm.
First
Yeah.
care ambassador we hired, started supporting my wife Melody. And what I've learned through getting the support from my care ambassador, it helps my and Melody's relationship. And what I
Mhm.
mean by that, when I come home, Melody's with Laurie, our care ambassador, for 9 hours a day when I'm running our business. When I come home, Melody's smiling. She's happy. I'm rejuvenated from being out and working, doing something that I love. Meals on the stove. The prescriptions were picked up. The laundry's done. Errands were done. So instead of coming in and being overwhelmed with catching up on home responsibilities that I have to do on my own, I'm with Melody. So that evening, I'm connected with Melody, and I'm Melody's husband. She's my wife, and it's from a relationship standpoint, a very dreadful disease. It helps provide that time and space for the connectivity instead of catching up on things. So that's why I say we really focus on the family. We help give the family peace of mind, but also time and space and relationship space with their loved ones.
Mhm. And I think, this is what I run into sometimes with families, too, is they often, even if they have care coming into the home, they don't maximize it as much as they could, you know?
Right.
And so I'm always like, whatever hours you have for the companion to come in, that can always increase. Like you're not locked in at 20 hours a week or whatever. And that's what's so great about the home care model is as your needs change or as your loved one's needs change, you just increase the hours and increase the services. Because I've had clients that have been on, their parents have been on home care for months and they didn't even know that, and the daughter is still like taking time off work to drive dad to his appointment. Well, it's like, no, the home care worker can do that. you know, Outsource what you can so that you can have that relationship that you need to have with your loved one.
It's a great point. When we do our living room meetings, up front, we'll obviously assess the care partner's needs and wants, but then we ask could be the spouse or the kids of, what do you want? What do you need? And then that's where you create the space for them and communicate, oh, we could do that. We could do that. We could take care of that. And then you just feel like this thing's falling off their shoulders. But majority of our clients end up adding hours after they experience what we can do. They'll go from 20 to 30, from 10 to 20. Once they see and the relationship's built with the care ambassador, a lot of times that'll happen. It'll increase the hours. Yep.
That's right. Because at first they're a little bit, intimidated or just cautious because they're like, I don't know, this is a stranger coming into the house and like, what really can you do for me? But once they can like fully take a deep breath, like, oh, I don't have to worry that, I called dad on my lunch break and he didn't answer the phone. Is he on the floor? Like, did he take his meds? Like, did he make it to his doctor's appointment? Like, once the family has that like sense of relief, then it's like, oh, and they trust you. That's, once you've established that trust, then yeah, those hours increase and life is good for everyone. So any closing comments on your part? Like, how could people get a hold of you if they want to learn more about your home care company?
Good. You can go right to our website, www.newhorizonathome.com. newhorizonathome.com. You can also call me directly at 925-856-2491.
Yep. Yep. Excellent. Is there anything else that you would like to mention in the podcast today?
I like what you said earlier about looking at our whole system. I think that we need leaders in our field need to get together and work together to build a continuity of care and services. So when I first met you, the light bulb went off right automatically. how you could help our clients and their families. So now I know that you're a trusted source that could help our clients be more proactive, help plan in other areas besides the direct care to give them more value and more space in their life and more comfort and have a plan. But I think if our field works together, instead of working in silos and taking care of one thing, if we work together, we can help the whole journey that the family's going through.
Amen. I say that. I've said that probably a million times in my career. So it's just a matter of try to find other people like you who have that same vision for healthcare done right. And unfortunately, there's not as many of us as I was hoping that there would be in our industry. So we got to find those gems, and then we just nurture those relationships, and then eventually we'll find other people like us, and then we'll build this really beautiful web of services so that all families all across the globe can have the best possible aging and caregiving and dementia progression journey. So that's the goal. So, all right. Well, Kevin, it was such a great time talking with you. Thank you for all you do. And it was just great to have you on the podcast today.
Thank you again for having me. Appreciate it, Natalie. Thank you.
You're very welcome.
Thank you for tuning into the Care Right podcast. We hope today's discussion has provided you with valuable insights. If so, don't forget to like, subscribe, and share our podcast with others who might find it helpful. Remember, Care Right is more than just a podcast. It's a community dedicated to supporting family caregivers with comprehensive care planning, crisis management, and resources for every stage of aging. Stay connected with us for future episodes as we continue to explore essential topics in aging planning, elder care, and financial planning. Until next time, take care, plan wisely, and remember, you're not alone in your caregiving journey.